Welcome to Aspen Vibe. We are so happy to have you joining us this Thursday night and spending a little time with us. And I am here with three of my colleagues. I was just talking to these guys a little bit ago about how much tenure's on this phone or on this video right now. You've got a power group here to answer all the questions that you might have. So I know you got a little snippet of who we are, but I thought it would be good to just go through that real quick. My name is Lori Deanna. I'm the Senior Vice President of Operations. I started with Aspen Dental Management in 1998, and I have had a number of positions in my career, from dental assistant, front desk receptionist, regional manager, dental hygienist, office manager, and so on and so forth, up the ladder to VP of Operations. So I am really happy to be here with you today. And Jerry Ann, I'm going to hand it over to you.
Okay, I'm Jerry Ann Albright. I'm actually a hygienist with Aspen for 20 years. It will be in July. It's kind of fitting that I'm talking to you tonight from where it all started for me in the Rotterdam, New York office almost 20 years ago. I've been a territory manager of hygiene support for about 3.5 years now. So that's that. Doc?
Hi, everyone. I'm Dr. Damian Myers. I've been with Aspen since 2014. I started as an associate. Now I'm a POP. It's been 2 months. I love the organization. I look forward to working with you all.
Hey, everybody. My name is Anna Morgan, and I'm a hygienist currently with Aspen Dental. I've been here since 2011, and I've done a couple of different things within the organization. I've worked as a territory hygiene manager, a hygiene coach, and a hygiene director for a few years, and had the pleasure of having some of that flexibility to be able to be a clinical hygienist when I needed to. So it's been a fun journey, and I'm excited to be here to speak with everyone tonight.
All right, awesome. Well, I have a ton of questions coming in, so it seems like we've got an active group, which is great. So let's jump right into it. All right, Doc, I'm going to throw this one to you. The question is, what do you look for in a hygienist? What are some of the qualities?
Some of the qualities I look for in a hygienist are: one, someone that's going to educate the patient. And I look for this in all my team members. And two, do what's right for the patient. So educate a patient, tell the patient what their conditions are and what treatments are necessary, and explain the treatments of the patients. Very important.
Great. Okay. Anything else in your experience, I guess, Jerry Ann and Anna, when you think about bringing new hygienists onto the team, what are some of the things that you guys look for?
And I can take that one. What I really look for is passion, professionally and in your personal life. I don't ask a lot of the situational questions during interviews. I really want to get to know you as a person. And I just think, I really think it all comes down to passion.
Yeah. And I think that's a good way to say it. You know, it's a passion for what you do. It's a passion for treating patients the right way. It's someone who's enthusiastic about dentistry and taking care of people and having fun. I think you'll find that that's a big part of our culture. We work hard, we play hard, and if you've got those qualities and you're passionate about it, this is the right place for you.
I agree.
All right, let's see. Okay, so I think actually one question that I have, because you and Doc, you and Anna work together in the office, there's a couple questions on here around treatment planning and how you work together. Do you guys want to talk a little bit about that?
Okay, Anna, could you jump in and I'll piggyback with you?
Sure. So as far as treatment planning goes, I perio chart all of our new patients. We perio chart our patients at least annually. And so I work really closely with Doc once that perio chart is completed, just to really determine what treatment plan we're going to have for the patient. He and I are pretty much on the same page, so it's really nice to have a lot of autonomy, but we do communicate on those patients who, might be borderline if we're going to do like a prophy or scaling a root plating.
And I'll add in, based on what Anna just said, yes, if Anna sees a patient and we're not quite sure what direction we want to go in, we'll collaborate and decide what's the best course of treatment for that patient. If I'm unsure, I'll have Anna in the room. Anna will come in, perio chart, and we discuss what course of treatment is best for the patient. So we always collaborate. on every single patient in our offices.
That's great. Yeah, key thing there is the partnership that exists between you two. I think that's a big deal, and that's why patients say yes and get started. It's a team effort there. There's a question here, and I think we're going to have a lot of these types of questions. What's the best advice for a first-time hygienist entering into the workforce? Anna or Jerry Ann, who would like to take that? I'll give it to you, Jerry Ann, actually, because Anna just went.
Okay. I would say don't be so hard on yourself, especially in the world that we're living in right now. This was an especially difficult year for anyone professionally and in school. And there's a lot of anxiety right now coming out into the workforce. A lot of unknowns. A lot of hygienists have been working on mannequins and didn't get to see the real life patients that they were expecting to. So just don't be so hard on yourself clinically. With Aspen, I mean, we're here to help you and guide you. And everyone knows right now. There's a lot of students on this right now, correct?
Yeah. So yeah. I think, you hit on a couple of things that I just want to pick at a little bit more. I think one of the things that we've got nailed down that I think means the world to students that are just joining the workforce is we've got a plan to integrate you into a schedule, right? So it's not like you come in day one and you're seeing patients right out of the gate and you've got this full schedule and you're trying to figure out time management. We are going to help you get your feet under you. So these guys talked about the position of territory hygiene managers. They're key to your success and full integration into the offices. They're going to come in and spend some time with you to kind of get you acquainted with the offices, the supplies, helping with that partnership with the doctor right out of the gate, because it does take some time to get that type of collaboration. But you're going to be paired up with a mentor, and it's a full 2 weeks before you're fully integrated into a schedule. So we are going to hold your hand and help you through anything that you need. And if you're feeling like you're getting this, the hang of things and you want to move faster, you just have to communicate those things, because I think everybody learns at a different pace. But you are not going to just be thrown to the wolves. I think that's something you need to know out of the gates. Anna, anything you would add to that? Because I think that's a big one.
Yeah, so I think that the training program really is helpful because you do have that mentor that you're paired up with, and it's really nice as you get your feet under you. Like Jerry Ann said, a lot of people, you didn't have a lot of those practices that perhaps other hygienists had. So it really helps you to learn the flow of the office. It helps you to learn the scheduling and just make you feel a lot more comfortable, especially if you are fresh out of school. So I think our training program is really a great program to go through.
And I'd add, what I like about the program too is if you're not comfortable after the initial 2 weeks, we work with you, we help you out. If you need more preparation, we guide you along, and there's always a mentor there for you to answer, to ask questions. And so it's very important, and we take pride in that.
I agree, all of that. Okay, what do you expect out of your dental hygienists? Anna, you want to take that one?
So as far as dental hygienists really is to help our patients to get the care that they need, to really communicate with the doctor and with the team about what those patients need, what their treatment plans look like. Like Doc said earlier, patient education is a huge part of this. I think also being flexible, because one of the great things is that we're always implementing some technologies to be able to improve patient care. So I think that those are some of the things that are really expected from our hygienists.
Okay, great. Let's see. Why should I work with Aspen Dental? Jerry Ann, you want to jump in on that one?
Well, I would say in my personal experience, work-life balance. I was a single mom my whole entire career with Aspen until recently. And just that, my loyalty to Aspen is because of that, the flexibility with the schedules. I just will be forever grateful.
And it's funny, you mentioned that as your number one, and you think about some of the misconceptions of working with a DSO and that there's a lack of that type of environment. And it couldn't be, it's the opposite, and so we've got to get that message out there to everybody that's listening today. You've got the flexibility in your schedule. And I think these guys have some great examples of being able to flex their career paths when they needed to, right? So you can determine that. I also think one of the great things about being a dental hygienist here, working at Aspen Dental alone, whatever position you're in, but because I've been lucky enough to be a hygienist here as well, and I was also working in a private practice a couple of days, just because I wanted to kind of see the difference. And I felt like being here, I was a co-therapist with the doctor. I was encouraged to partner and collaborate, like Doc mentioned earlier. And I could see my career path going in a number of different ways. As you heard from what I described earlier, I've been on both sides of the coin here. I've been on the clinical and the business side of a dental office. And I don't know that you get that opportunity in other organizations. So I think you've got the autonomy, you've got the flexibility, and you've got a career path that really you can determine your destiny there. Anna, would you add something to that?
Yes, I actually wanted to jump in and say something along those lines too, because I started out as a clinical hygienist, and then as I grew my career with Aspen, became a hygiene director. And there was a point where I realized that I needed to be home more. And so everybody has been so gracious, and it's so wonderful to be able to stay within the same company and to transition into something that I can be home more and to have that flexibility. So I'm so grateful for Dr. Myers taking me back, but that's
grateful.
Well, it's just something that it has really amazed me, just the flexibility that I've had to have that work-life balance.
So I'm not going to let you off the hook, because there's actually a specific question around flexibility in work schedules. And I think let's talk a little bit about the flexibility within your daily schedule, because I think one of the other common misconceptions is that you are not in control of your schedule, meaning times and how many patients you see. There's all these things out there. I actually have a question here about quotas that you guys asking if there's quotas that you need to make. So there's this common misconception that you don't have the flexibility in your schedule or the autonomy. So can you talk a little bit about your daily schedule and what that looks like?
Yeah, absolutely. So I have an hour for all of my prophy patients. If I need more time, then I am able to have that time. But when Dr. Myers and I are treatment planning those patients, that's when we determine, okay, if this patient is scaling and root planing, do I need an hour for half mouth? Do I need an hour and a half or 2 hours? So we partner together, and then I determine how much time I need for those patients. So it's not a set cookie cutter amount of time, but I have at least an hour for my prophy patients, and I have at least an hour for 2 quads of scaling and root planing. But I see maybe 8 to 9 patients a day. And, I really have that flexibility. Dr. Myers knows that I'm very in control of my schedule. This is one thing that I manage very closely to make sure that I can give my patients that care. I'm not willing to cut down on that amount of time. And we certainly don't have quotas. As Dr. Myers said earlier, that patient care comes first.
Mm-hmm.
Yes.
That's great. Yeah, couldn't agree more. Would you say you're one of our type A personalities there, Anna, like the rest of us?
Absolutely.
So, Jerry Ann, you want to talk a little bit about if we don't have quotas, right, which we know, but we do talk a lot about performance, and you guys give coaching, especially in the TMHS role. You want to talk a little bit about performance and how you measure that and how you talk about it with your teams?
The way I talk to my hygienists and actually office managers and the doctors is more, it's not really surrounding production numbers. It's more the behaviors behind certain measurements. So I'll go into an office and I'll look at, say, the adjunct percentage. If that is very low, then I feel that, okay, patient education in this office is an issue. Communication between, the handoffs between the back to the front, the consult, maybe the office manager is stripping treatment. So I'll use those metrics to guide the hygienist or the doctor, the office manager, in a manner to be able to help the patient to accept treatment. Anything like Arrestin. If Arrestin percentages are a little bit low, locally applied antibiotics with scaling and root planing, maybe they haven't had proper education. Maybe the school that they went to didn't really cover this. So I'll send in support, somebody from Aura Pharma, or we'll have a lunch and learn. I'm constantly, I want everyone to learn and grow. I still am after 20 years. I still learn something new every day. So that's what it's about. Doc touched on it earlier. As long as we are doing right by the patient, we're educating them. That's really all we expect. Everything else really does fall into place. It really does.
Yeah, I think the point there that you made around the metrics, I mean, we've got measurements for everything because it helps us look further into behaviors and understand what's going on. I think that's a great point there that you brought up. We really use it as, okay, what's going on in the office? And then let's help coach on how do you talk to the patients about home care and the importance of home care. Make sure they understand that. All right, so what brand of instruments does Aspen use, or is the RDH allowed to choose? All right, go ahead, Jerry-Ann.
This is actually one of my favorite parts of my job. I spend a lot of time with my new hygienists. I'm a little territorial the first week. I spend every minute of every day the first week with my new hires. And that first day in the afternoon when we open the Henry Schein book and I say, okay, so what instruments do you like to use? What Cavitron tips? And they are always in awe. It's like a kid in a candy store. I never get sick of the reaction. The smiles, the fact that, they can use, I mean, their instruments are an extension of their hands, that's part of their craft, and you should be comfortable with what you're using. So yeah, there is not a particular brand. It's what you're comfortable with.
And I think part of that question comes with another common misconception, which is I'm not in charge of my supplies. And Jerry-Ann, I think you hit on that. But Anna, anything that you would say on that?
Just that we order our own supplies.
Okay, great. Yeah. All right, good. We've hit on that one. What opportunities for growth are there within the company for dental hygienist positions, if any? And I do want to expand on that a little bit because, you heard our stories, and that is not, we're not unique to the organization. There are a lot of us around here that have had different experiences throughout the organization, and that is, it's awesome because sometimes you don't know when you want to dabble in something else, but this organization really encourages you to continue to develop and grow and do more. So really the sky's the limit. I mean, we've got hygienists that have grown in the hygienist position from an associate position as a hygienist. So meaning you're coming straight out of hygiene school and you're partnered with a lead hygienist. They're going to help mentor and develop you and help you really feel confident. And then maybe you want to go to your own practice. You're going to be the lead. You're going to mentor another hygienist coming into practice, which is great experience to be that mentor. But then maybe you want to take a step onto the non-clinical side and become an office manager. I can tell you that some of our most successful office managers have been a dental hygienist, a dental assistant. They can answer the questions that the patients might have, and they help patients just gain trust and want to move forward. So. And really, you could take it anywhere from there. I mean, the sky's the limit. Anna, Jerry-Ann, I don't know, anything you'd add there? Or did I nail it?
I just think that there's phenomenal opportunities. I never saw myself when I first started beyond just being a chairside hygienist. And it really took somebody to tap me on the shoulder and say, hey, you've got what it takes and I believe in you. And I think that that's something that we are very focused on is if you have career aspirations or, maybe you don't even know that you have them, but we're always trying to help support and grow our people.
Yeah, I never knew that I wanted to do this. I always thought that I would be with patients. I love that one-on-one. I love the instant gratification that you have when, they leave and they say thank you, and you're learning about their families, and you grow friendships with your patients over the years. And when I first switched over to this role, it was a little hard for me because I didn't have that. And I thought I would miss it. I'm still clinical quite a bit. But now I have my hygienists there. I'm like the mom, and I get gratification out of seeing them be successful. And even do things like this for me is outside of my comfort zone. And
You're doing great. You're doing great.
Oh, I would have said nah a couple of years ago, but I just love seeing all my hygienists grow.
Awesome.
I really do.
Hey, Dr. Myers, I'm going to ask you this question because you just recently made the decision to become an owner, right? So now this is your office, and the question really is about, there's a lot of concerns around corporate dentistry. And the term is an odd one because I don't know that you would call what you do corporate dentistry. So you made a big decision. So you want to talk about that a little bit and alleviate some of these concerns about this corporate dentistry thing?
All right, great. I used to think about corporate dentistry before I applied to Aspen. And I came in thinking I was going to do corporate dentistry. When I started, I realized it was farthest thing from the truth. I started as an associate. I was doing all my treatment plans. I didn't have anybody from corporate dictating how I treatment plan, how I treat patients, how I execute my treatment, my conversations with patients. I only had mentors to educate me on how I approach patients and how I approach treatment. So I don't practice corporate dentistry. I practice dentistry. Anna and I have worked together for some time now, and we do not practice what is considered corporate dentistry. We practice dentistry, and we treat our patients with the best care possible for each patient. So we're not corporate dentists. I don't know what that is.
Add something to that too.
Yeah.
So going back to when I was graduating from school, I swore I would never work for Aspen because I had heard that all these bad things about them. And then I ended up having to apply for the position because there were benefits available. And I thought, okay, I'll just do this until I can find something else. But once I started and went through some of the training, I realized that I had that autonomy and that it's not corporate dentistry. I was treating patients the way I learned in school. And so to this day, I still try to treat those patients the same way that I learned in school, aside from some things that may have changed, with guidelines and things like that. But, I wouldn't still be here today if we were doing corporate dentistry. I have ethics that I have to uphold in that patient care. To me is it comes first.
I'll jump in again. Yeah, when Anna and I see a patient, we don't think what we're going to get from this patient. We think, what does this patient need? Yeah. And so we treat the patient's needs. And a lot of times we get patients coming in for wants, but we treat what they need, not what they want. So no, we definitely practice dentistry.
Yeah, no, that's great. I know, it catches you off guard because you never think about it, but it is a common misconception out there, right? So I think it's important for everybody to hear that this is your office, these are your patients, you're working off of your treatment plans, and you're partnering together to provide the patient the best care possible. What Aspen Dental Management does for practices like Dr. Myers' practice and for the 800 plus locations across the organization is we provide business services to practicing dentists. So what does that mean? That means on the back end, the IT, the legal support, the risk and management support, the you name it support that has nothing to do with delivering care. That's the thing that we help the doctors with, right? So that they can focus on what's most important to them, and the hygienist as well. You're going to come in and you're going to see the patients that our marketing department has, driven to your office. You don't have to worry about that. You're going to have a full schedule, and you're going to be able to use the electronic system that we have that the IT department designed and is up and running. Those are the things that we do. The rest of it, is really expected that the licensed practitioners in the office are going to do what's best for the patient. And I don't think it's any different than any other practice as far as that's concerned, as far as treatment planning, and than any other practice you would go into. The dentist is the dentist, and he's doing his treatment plans. Okay, so there are some questions around flexibility and schedules. You guys touched on this a little bit, but in the organization, are you guys now looking for part-time help, or is there 2-day a week, or anything like that that you can expand off of, or are we strictly just looking for full-time 5-day a week hygienists? Jerry Ann, I'll call on you for this one.
Okay. I have a hygienist that only works Saturdays. She'll work any Saturday that an office is open. I had a phone interview with someone yesterday. I'm meeting her tomorrow morning. She wants 3 days a week. I have another hygienist that I'm meeting next week, and she wants as many hours as we'll give her. Can she work 6 days a week? 5 days in one office, and she'll work Saturdays. So we'll take whatever you're willing to give us, pretty much.
Yeah. Okay.
We're very flexible.
Flexibility for sure. All right, there's some benefit questions here. So there's a question around, are there benefits associated with the position like 401k and insurance? Yes, there is. You also have vacation time and personal days. And, yes, you have a complete package. I think one of the other cool things about working with Aspen Dental is that, in private practice, sometimes if the doctor decides to go off for a vacation for a month and a half with his family, you're forced to take the time off whether you want to or not. And usually it's not a full month and a half that you're paid. I'll tell you here, you've got the flexibility to take time off when you want to. And when your doctor goes on vacation, Dr. Myers is going to find the backup support for his office because we don't close. I mean, one of the things that we pride ourselves on is being accessible to the patients. And so that means that we've got the opportunity for you to continue to work when our doctor is taking a vacation, which I think is really great. One of the things I want to touch on, because there's a theme in a lot of these questions about COVID and post-COVID, and how did you feel, working through that time? I know you touched on it a little bit, Jerry Ann, of like, life was a little bit different and a little bit scary, but can you give me just a quick synopsis of, kind of how that felt for you and how it felt to be at Aspen Dental through all of that?
Yeah, I before the end of the world last year, I actually got married on March 13th last year. And then
we were in the thick of it.
We were in the thick of it. And then we were furloughed the following week. And I have a group me. A lot of the territory managers have group me's, teams, any type of text messaging groups. So I had the group me, and we stayed in contact, all of us. I know more about unemployment insurance than I ever wanted to know for New York, Vermont, and Massachusetts. But we stayed in touch, and they never wondered what was going on. I never wondered. We knew that they were supplying us with all the PPE that we needed. There were constant updates as to, depending on what state and when we were allowed to reopen. We ordered dry shields for all of our hygienists, 2 for each hygienist. Face shields, loops. If you have loops, and the face shields that ADMI sent didn't fit over the loops with the light, we would try to find one that would fit, and if it didn't, then we would, find one and expense it.
But we made every attempt to really keep our team members feel safe. Yeah.
Yes, for sure.
Yeah. Okay.
For sure.
Yeah, and when you talk about, I think it's, I'm so proud of this organization and the way that we maneuvered through a really crazy time. We made some difficult decisions to close about 500 locations at the peak of it, probably right after you got married, Jerry Ann. Yep. And the reason why we did that was because the PPE, we needed to make sure that we had enough to keep our team members safe. We rewrote workflows immediately. We made every investment to make sure that our team members were safe, the patients were safe. We went to emergency care only in certain, for every state for a certain period of time. We tried to stay connected with everybody and brought everybody back as soon as we could. We actually, during this time, one of the questions on here is about continuing education. But one of the things that I think I felt was really, it makes me proud, is that not only did we offer continuing education for our teams, we offered continuing education for everybody in the dental world across the US, because we knew that if they couldn't go into the office and they couldn't see patients, their brains were still wanting to do more and spend that time, at least on things that controlling what they can control and trying to stay focused. So I think, making sure that everybody had information real time was important, because the safety of our team members was what made us make the adjustments in the count of offices that we had open. So really proud of this team. And would you say, Anna, that life now, how does it feel different than, March of last year?
Honestly, as far as like the workflow in the office, or
and just safety wise, and how you feel about practicing in the office now?
So I can tell you that I was very concerned about coming back and concerned about what that would look like, and thought that, that would be hugely different. So, we were already following a lot of the things that they had recommended. So coming back right now, the workflow is very smooth. We're wearing face shield or, a second mask still, but I think that as much as we're back to our quote unquote new normal, and I feel very comfortable and confident in the offices, as far as their cleanliness and the things that have been put in place for us as clinicians.
That's great. I don't know if you guys know this, but during that time frame, we had about 8,000 CE hours earned by folks during that time. So definitely worked. It was active. It kept people engaged. Jerry Ann, on a normal, forget about COVID time, but during the normal years, can you tell me a little bit about your opportunity with CE and how important it is for you, your teams, your doctors, and what's offered to you?
It's actually one of the top questions I get during interviews. It is very important to a hygienist. We offer so many CEs. We have free CEs, as well as opportunities for live CEs in the offices. We also set up CPR training, so you're not having to go look at local venues.
So we guide you through that. We get you hooked up, and we've got tons of opportunities for our teams to get all the credits and more that they need.
I haven't had to pay for a CE in 10 years.
I haven't.
Well, there you have it, everybody. They haven't had to pay for 10 years.
Pay for a CE.
All right. So I am currently in school for dental hygiene. What are the main things I should have my extra focus on while I'm still in school in order to be successful at Aspen? Anna, you want to take that?
That's a great question. School. It's like boot camp when you're in school.
True.
So I think it would be good to shadow at an office. I think that would give you a good idea of what it looks like, and maybe if there's some things that you're unsure of, it'd give you a chance to even get a mentor, perhaps. But honestly, I think school is your main focus while you're in school.
I could add to that. I think for me, I obviously went to school and then I did residency. But what I've learned is when you're in school or in residency for dentists, the key is learning as much as you can and taking risks with guidance while in school. That's the time you have an opportunity to learn a lot. And so the more you put into it, the more you get out when you get out of school. It's really worth it to put in that extra effort while in school.
Yeah, I think that's great advice. The only other thing I would add to it is, the way that you manage patients, the way you talk to patients, the way you educate patients is really, really important. It's probably the most important thing, because I know you're so focused on your technical skill and am I going to get every piece of calculus out? And I remember feeling that way. But the reality is it's more about, for the patient, it's more about how you're managing them, talking to them, preparing them for when they're not in your chair. You'll get that if you miss a little piece of calculus, you'll get it when they come back. But hopefully you've established an amazing relationship that they want to come back and they trust you, and that's really important. Because I think that's what helps patients say yes to care and want to get treated in our offices. All right, so there's some questions here on can I come on to Aspen Dental as a dental assistant while I am still in dental hygiene school? Jerry, I'll throw that to you.
Oh, yes, you can. We're actually starting something with one of the local hygiene schools to allow the students to be a hygiene assistant during the summer or during a break. It can be 2-week, 4-week stint in an office that's closest to their home or close to the school. So yes, by all means.
Mhm.
I think it gives you great experience, right? And it helps you start to hear some of those conversations with patients and talking about home care and all of that. It really helps you see it live and in action. And I think it's great experience and exposure. Okay, so there's a lot of questions here on pay, which I know that you guys would be shocked if we didn't have a couple of questions on pay. So, so Anna, can you talk a little bit about how the dental hygienists are paid? How are you paid? And yeah,
Absolutely. So I get paid a flat hourly rate, and then if I get paid profit sharing on top of that, there's a couple of other opportunities also for us to earn some incentives. But basically, if the business makes a profit, then I get paid a profit. It's very similar to how the doctors get paid. We also get some incentives around Invisalign or clear aligners that we're doing. And then there's also some that are focused around our patient care and our patient satisfaction. So that's pretty much it in a nutshell.
So yeah, just to expand on that a little bit more, what we try to do is make sure that we look at collectively. I think Anna, this is where collectively how the office is profitable and how many patients are saying yes. Are they happy? New patient satisfaction rolls into the calculation because it's key. And so on average, our dental hygienists are making around $42 an hour, but really you are in total control of your overall pay. And that's what, you really need to understand. We have hygienists that are really focused on helping educate patients, not just on dental hygiene specifically, but on the impact that orthodontics can have to their home care and dental hygiene overall. And so by doing that, by talking about that to patients and helping them understand that, there's skin in the game for you too. And so you have the upward ability to make whatever you want to make by really being active in the office and really managing your schedule. So some of our hygienists are making over $90 an hour. And what are they doing differently? Well, they're talking to the patients about educating them on things that they need for their long-term overall health, but they're also tightly managing their schedule. When they have a patient that cancels, they're proactively up front. They're working those reports. They're getting patients in. They're starting that new patient the same day. After they're probing, if they see that the patient has an urgent need, they're trying to get them in their chair if they have an opening. The ones that aren't doing that, they're not as profitable, and they're not as productive, and they're not really using their time as efficiently. So we really give you an upside to, if you're going to maximize your time and you're going to maximize the opportunity for patients, you're going to see that in your pay. But really, you're the one who controls all of that. So, it's a huge opportunity for you to really benefit. And you know what? The cool thing is the patient benefits as well. So that's really great too. All right. Let's see here. Who sharpens your instruments? Doc, they don't make you sharpen their instruments, do they?
Not at all.
You do. You sharpen your instruments the way you like them. It's funny, but you think about, I'm sorry, my dog is interrupting. You think about the things that are really going through your head when you're just graduating school. So that's great. All right. So what is one piece of advice that you would offer a dental hygienist about an experience? This is very detailed. About an experience with Aspen Dental, good or bad? Like what's the one thing you would want these guys to know? Doc, I'm going to start with you because I think you've got a ton of stories.
I would say growth. For me personally, there's a lot of opportunity for growth, whether it's financial growth, personal growth, career development growth, clinical growth. Growth is the one thing or the main thing for me here at Aspen.
All right. And Jerry Ann, the one thing that you've experienced here that maybe you didn't expect initially, good or bad?
I would just say the amount of support, because when I first came out of school, I was hired with Aspen, but I also worked at a private practice, because in school they drill into your brain that, you know, private practice is where it's at. And I still felt like I needed to have that experience. And Aspen was very close to the school model. I felt like we're treating patients as we see them, not how insurance dictates it, or afraid that the patients will be upset. So I think that the fact that we're closest to the school model, we do things the right way. And the support is amazing. You're not in a bubble by yourself. You always have someone to turn to, and there's a safety net, always.
Yeah, I think that's, that's the network that you have, the network of people that you have around you. I mean, when you think about an organization that has 800, almost 900 locations, there are a lot of wonderful people that are surrounding you at all times that you could reach out to for whatever it might be, whatever position you're in. Mm-hmm. And I think that's probably the hardest thing that for me over the last year is we are really a family, and that dynamic of seeing each other and getting back connected with one another is something that's been missed. And I guess for me, I never realized how much that was going to be a part of my life. I mean, when I came here, I was expecting to come here part-time to go to dental school and get my feet in the door. I never became a dentist because I took all these other avenues that I never knew existed. So that for me is probably my story of like, what did you not expect? Like you, Doc, I didn't expect the opportunity to grow. And I really didn't know what a DSO was. I mean, it's 20 plus years ago now. I didn't really know what a DSO was. And if I didn't have this experience, I would have missed out on my calling, because this truly has been the best experience of my life. And I didn't know that there was this whole like business side of a dental office, because I just thought I had tunnel vision. I was going to dental school. Well, being a dental hygienist, it helped me see that really this was my calling. Because when I was in an operatory and I was just, I was in a patient's mouth all day, my brain was going in 1,000 other positions. I probably drove the office manager in the office that I was in completely nuts, because I would ask her, did they accept? Why didn't they accept? Did you do this? Did you do that? And I was obnoxious. I probably would, she probably could share a ton of stories of how she wanted to kill me. But but so that's my story too. I didn't know that existed. But Anna, what would you add to that?
You took what I was going to say, but
sorry.
It's okay. I have been a chairside hygienist for a year now, and I think coming back to it for a year now. But one of the things that I miss the most is the relationships that I mean. It's a family. When we would go a little bit of time without seeing each other and we finally saw everybody again, it was like a family reunion. And so I miss those people that I no longer get to interact with. But, I have Dr. Myers now in my team, and we're becoming a family slowly here. But I think it's the relationships with the people that you're working with. It's amazing. They're family, right? You spend more time there than you do at home when you're at work all day. So I think that's something I did not expect. I just expected to come to work and go home and then do my thing.
Okay. This one is a doozy. We're going to end on this doozy, okay? Because I think it's going to take some time for us to talk through this one, because this is a big one. Now, Doc, how long have you been with Aspen Dental?
Almost 7 years, 6.5.
7 years. All right. Jerry Ann?
Almost 20.
Almost 20 years. Anna?
Almost 10.
And me, too many to even count. So the question is, what can be done to overcome the stigma that corporate dentistry is focused more on quantity than quality? Now, this one, I'm sure, is like a knife through your heart, every one of us. So, Doc, I'm going to go to you first on this one.
For me personally, in my office and our team, as I said earlier numerous times, we treat patients and give them the best quality of care that they need. We don't, in our offices, we don't do or treat patients based on production and dollar values. We treat patients for who they are and what they need. And so that's the biggest thing for us in our offices. And we stay true to that.
That's great. Yeah. Okay. Jerry Ann?
Yeah, this one always kills me because I'm so loyal after so many years, and I just think proof is in the pudding. You know, whenever I have somebody with me, we get on the computer. I show them schedules. I let them talk to anyone in the office. Hey, pick an office. Let's talk to this hygienist so you can pick her brain a little bit, or his brain a little bit. It's just showing them who we are and the schedules, and I don't know. I just feel like I've been with Aspen for so long that once they spend time with me and see how passionate I am, see it all comes down to passion. It's believable and genuine.
Yeah.
I think we all right here. Everyone here is genuine.
Yes, I agree. And that's the interesting thing of doing these virtually, because you always, like, I think one of our secret sauce is our culture, right?
Mm-hmm.
And it's something that you cannot fake.
Yeah.
So getting all of these people together, it's not just about what we're saying on stage. Most of what makes people say, "Oh my God, I want to work there," is they see us interacting together, and you cannot fake that. And so that's the I think that is the piece that really hits home who we really are and what our brand is really all about. Anna, what would you say to that?
I'd say come see it for yourself. I'd love to show you in the office so you can come see it, because I can tell you, all day long about who we are and what we do. But I think the best way is for you to see it. That's part of the reason that I'm here tonight, is to help people to understand, or to have a little window into who we are and what we really are about, and to have that opportunity to ask questions, no holds barred. So I think come see it for yourself. I'd love to have some people come to our office. I'd love to show you guys what we do.
I think that's great. Yes, there's an opportunity. You should, for those of you on the phone or on the screen that want to get more information and want to see for yourself, there's an office near you, and you should take the time. If you're conflicted, you should take the time to come into the practice. I promise you, some of the things that the reason why you're asking this question are probably because you've been in dental hygiene school and you've heard some negative references to not just Aspen Dental, but DSOs overall. I can tell you we're a very different DSO than probably some of the other names that you've heard out there, but you've got to see it for yourself. I too went in my very last week of dental hygiene school. The professor came in. I think she may have forgotten that I was with Aspen 15 years before I went to hygiene school, but she came in and she said, I just want to give you some advice. You should take your career into either community or into private practice. But if there's one thing that you should steer clear from, it's don't go into a dental service organization. And of course, I couldn't sit there and bite my tongue. I was sick to my stomach, and I was thinking, oh my gosh, she's killing my firstborn here. So I'm like, wait a second. Can I ask where you got your information, and have you ever stepped foot in a practice, and do you know the doctors in this market? And of course the answer was no. She had never had any affiliation with Aspen Dental at all. And so I ended up having the team down into a student center with no other professors, and told them the real deal of what we're all about and who we are and why it's such a great opportunity. And guess what? I didn't just have a couple of my fellow students join Aspen Dental, but I actually hired 2 professors too. So I call that a win. But why, you ask? Well, because they saw it for themselves. They felt it. And you're right, Jerry, and you said everybody on this call is really genuine and passionate. That's honestly, that is what makes us amazing. For those of you that don't know, my phone is blowing up right now with texts from everybody around this organization that's saying, you guys are doing a great job. They're rooting us on. And like, that's what you're about to join. And I hope tonight that you have had all of your questions answered to really help you make your decision. But if you have not, you have the opportunity to reach out to any of us, to any of the offices, to come in, to get the exposure, get the experience, ask the questions. We've got nothing to hide. I'm sure that, if you've got the question in the back of your mind, we've been asked it before, and we can show you how things really are here at Aspen Dental. So it's a huge opportunity, not just for you today as you're graduating from dental hygiene school, but for the next 5, 10, 15, 20 plus years. You've got a crew behind you that has been doing this a long time now, and we know how to help you achieve your personal and your professional goals. So I hope that you have had an amazing time tonight, and that you've got your questions answered. I'm trying to see if there's anything that, Dr. Myers, one just came in and said, are you looking for an RDH?
Yeah.
Anna, they're coming for you.
Come see us, please.
So are you guys looking?
Yes, we are.
All right, now you know where to go, and you know the guy to go to. You got him right here. And the reason why, so we're not looking to kick Anna out of the office, just so you guys know. But going back to, remember what we said, we've got this opportunity to bring folks right out of dental hygiene school and incorporate them slowly into a schedule, right? So you've got 2 weeks of that training, you're partnered with a mentor, but in offices where you've got a lead dental hygienist, you've got the opportunity to come work hand in hand and really partner with someone who's been doing it a long time. They're going to set you up for success. We are looking to expand our offices all the time. I mean, we're seeing, Dr. Myers, how many new patients do you see on average?
On average, 13.
We have 13 new patients?
We see on average about 10 new patients.
And how long has your office been open?
My office, so we have a new location over the past 2 years, but we were in a location before that for about 10 years. We just
Okay. So your practice is over a decade old. And so you've got a recall patient base and you've got a new patient base. And so you need extra hygiene hands in your office because you've got a lot of patients that need to be seen. And so Anna, you're looking for a partner in crime here. And I don't know if you want to talk about what that looks like from your perspective. I think that would be great for us to, I know I said I was ending, but we have a couple more minutes and I thought this is a good one. So tell me what does that look like for this associate hygienist starting with you?
So I'm looking for somebody that I can help to mentor and develop. So I want to be able to help somebody integrate into the practice, to learn the flow of our practice, how to talk to patients, how to educate them, that 2-week training program. And like Dr. Myers said, if they don't quite feel comfortable after those first 2 weeks, we really want to work with them. So I'm really looking for somebody to be that partner so I can help them to grow in their career. I know Jerry Ann can speak to this, but that's something I'm really passionate about is helping people to grow in their careers. So whether they're a newbie or they've been doing this for a while, I'm definitely looking for somebody to do this with me. So
actually, there's a question on this too. And so Jerry Ann, I'm going to give you this one. So there's, we're talking a lot about students and we do have, quite a few students here, but there's a question on here about someone who has been practicing as a hygienist for a number of years and is now looking to make a change. Any advice that you would give somebody that's in that point of their career?
I think some of the more seasoned hygienists that I hire, it takes them a little bit longer to acclimate. Because we do have a system in place, there are, we're following the AAP guidelines now, which everyone's still calling it the new AAP guidelines, but it's been out for a few years. So they're used to slight perio, moderate, advanced, probably prophies most of the day.
We've got a plan.
I completely lost my train of thought. What was I?
Well, we've got a plan. No matter, I think the point is this, no matter what point of your career you're at, we've got an opportunity to get you acclimated. I think it's an awesome opportunity. If you're brand new to dental hygiene or you've been doing this for a long time, it's worth it's worth getting some more information and looking to make a change in your career and going down this path, because guess what? There might be a time where you decide that you don't want to do chairside all day, every day.
Yeah.
And so this gives you an opportunity to really expand off of that too. So go get some information, come into one of the offices.
Yeah.
We would love to see you do that.
And I think the technology also, they're always excited because if they've been in the same office for years, maybe somebody that's been in practice for years, they don't have the 1 hour whitening, the iTero scanner, just some of the technology that we offer. And it's pretty exciting for them.
You beat me to the punch, so good job.
Yeah.
We're on the cusp of going through a whole digital transformation of our offices, where we'll be printing dentures and orthodontic trays and implant guides all within our offices, and really having this ecosystem, a digital ecosystem within our practices. And this makes a huge impact into how you treat patients as well. And so if you're talking to a patient about ortho, imagine you just do a dental scan, you print your aligners, and they start with their first trays. It's really exciting stuff. And look, we're gonna wrap on this. Thank you guys for all your questions that you answered, and being good sports and being yourselves and genuine, because I think that's the most important thing. Everybody needs to see that you're not some robots. You're just humans doing a job with the support of a management company that takes all the junk off your plate so you can focus on seeing the patients. But we are constantly evolving. We're constantly investing. We want to be the best. And so that means that you have everything that you need at your fingertips. And when you want something, ask for it, because we're always looking to do things differently and give you the opportunity. But this is a really exciting time for you to take the first step, not just for your hygiene career, but I think for your career to join an organization that's going to really help build off of what you're coming with and the skill set you're coming in with. So again, thanks for your time tonight. I know it's now 8:30 on a Thursday night, so I appreciate you guys hanging out with us. Hopefully you had some cocktails while you hung out with us, but it's worth expanding your horizons and go into an office, ask the questions, take a look around. We've got nothing to hide. We would love for that. And you know what? If you really want to get the dirt, just stop by, ask for a tour, ask to meet the doctors. I think it would be great. We hope to see you in one of our offices soon, and hope you have a great rest of your evening. Take care.
Right.
All right, guys. Thank you.
Woo. Thanks.